Does sentinel lymph node biopsy reduce lymphedema risk after lumpectomy? Imagine having breast cancer surgery and wondering if a less invasive procedure could help you avoid some of the common side effects. One such side effect is lymphedema, which is swelling caused by lymph fluid buildup, often in the arm on the same side as the surgery. When lymph nodes are removed or damaged during breast cancer treatment, the risk of developing lymphedema increases. Sentinel lymph node biopsy is a surgical technique that involves removing only a few key lymph nodes, called sentinel nodes. These are the first nodes to receive drainage from the tumor area. Because fewer lymph nodes are taken out, this procedure preserves more of the lymphatic pathways, which helps reduce the chance of fluid buildup. In contrast, more extensive procedures like axillary lymph node dissection remove many more lymph nodes and are associated with a higher risk of lymphedema. Research shows that the risk of lymphedema after sentinel lymph node biopsy is generally between 2 and 5%. This is significantly lower than the risk after axillary lymph node dissection, where the incidence can be much higher. Interestingly, the number of lymph nodes removed during sentinel biopsy matters. Removing more than 5 nodes increases the risk, with studies indicating about 3.7% of patients developing lymphedema when more than 5 nodes are taken out. Conversely, when 5 or fewer nodes are removed, the risk drops to around 1.4%. Because sentinel lymph node biopsy is less invasive and involves removing fewer lymph nodes, it has become the standard approach for staging the lymph nodes in patients with early-stage breast cancer who do not have clinically obvious lymph node involvement. This method offers a good balance. It helps doctors understand the extent of cancer spread while minimizing complications like lymphedema. It is important to remember that even with sentinel lymph node biopsy, some patients still develop lymphedema. The risk is lower, but it is not zero. Lymphedema can sometimes develop months or even years after surgery, so ongoing monitoring is important. In summary, sentinel lymph node biopsy does reduce the risk of lymphedema compared to more extensive lymph node removal procedures. The smaller the number of lymph nodes removed, the lower the chance of swelling. However, it does not eliminate the risk entirely. Patients should have detailed discussions with their healthcare team to understand their personal risk factors and the best surgical options for their specific situation. Always seek personalized advice from medical professionals to make informed decisions about breast cancer treatment.